So you have a patient that comes into the emergency department. They're 16 years old, they're coming in with their parents, and they're complaining of left testicular pain. Upon examination, they have no cremasteric reflex that's absent. And you notice that the left testicle is a little bit higher than the right side. They report to you that they don't have any kind of urinary symptoms. They do have that pain that started suddenly one day ago, and they haven't had any kind of fever. They did have a little bit of nausea with this, but no vomiting. So what would be the most important next step? And I'm going to give you the rationales in just a second here, but I'm going to go through the answers and you choose which one you think is correct. A, you're going to prepare the patient for immediate surgical exploration. B, you're going to start them on antibiotics and send them home because you suspect this is epididymitis. C, you're going to send them home on NSAIDs because this is something that you do not suspect is anything that's significant, and you're going to have them return in 24 hours and if the pain is not resolving. Or D, you're going to just reassure them and let them know that this is pretty normal finding for someone their age to have testicular pain like this. What's your answer? Comment below. But let me jump into the rationales. So, if you have just a second. If you picked A, you're correct. So what we're suspecting here is testicular torsion. And the reason why that is that cremasteric reflex being absent. Anytime that there is disrupted nerve supply to that cremasteric muscle, that's why we have the absent reflex. And that's typically seen in something like testicular torsion. So this is a vascular emergency. You don't end up losing your testicles because of disrupted blood supply. So that's why it's a surgical emergency. So that would be the answer that you should pick if you had those options. B, suspecting that's epididymitis. Well, with epididymitis, you are going to have the cremasteric reflex present, whereas in testicular torsion, you won't, like in the case of this person. When you have testicular torsion, that torsion or that twisting can disrupt the nerve supply to that muscle, and thus the reflex is absent. The thing about the difference between epididymitis and testicular torsion is that epididymitis, you're going to have that cremasteric reflex present. C, send them home with NSAIDs. Well, because this is a surgical emergency, you don't want to delay. You really want to get them seen within 6 hours, into surgery really in 6 hours, because of the fact that you can have testicular loss. So no sending them home, don't do that. D, you are going to reassure them that this is perfectly fine, perfectly normal. Absolutely not. Testicular pain needs to be taken very seriously, especially if it happens suddenly. Any delays obviously can cause that testicular loss and significant problems down the road. It can cause irreversible damages. So if you chose A, that is correct. Hope this helps, and make sure to follow along.